All right. Hi, everyone. Good morning and welcome to our first session of the SCID Compass Summit. You have arrived at Mental Health and Coping with a SCID Diagnosis. Joining me this morning are Melissa Raspa, Senior Scientist, and Oksana Kutsa, Public Health Analyst from RTI International, as well as Jody Taub, who is a private practice psychotherapist. Welcome, everyone, and we hope you enjoy this session.
Thanks, Emma. So I'm Melissa. I'm going to get things started and then eventually we'll be turning things over to Jody. So welcome again. I'm just going to pull up our slides to start sharing my screen. Okay, hopefully guys are seeing the full screen, the slide deck here. So like I said, I'm going to get things kicked off. So welcome to our session. We're really looking forward to sharing with you the work that we did this past year around mental health and SCID, and sharing with you a little bit about the perspectives and experiences of parents that we've heard from them. So here's just an overview of what we're going to be talking about today. I'm just going to start to kind of give a little bit of background about how we got to this point. So I'll start with a quick summary of the SCID journey based on the work that we did early on in the project, and also give a little bit of a refresher on the work that we did in the fall of 2020 around interviews with families around uncertainty in the SCID journey. And then just want to share a couple of brief snippets and really transition us to really focusing on mental health and how uncertainty has been related, and in SCID has been related to parental mental health. Then we're really excited to share with you about a 10-minute video that the SCID Compass team has created that's going to be shared more broadly after today, but you guys will be able to see it around, again, some experiences that parents wanted to share around their mental health. And then finally, and most importantly, I'm going to transition it over to Jody, and she's going to take the second half of the session and talk a little bit about strategies for managing mental health. So just to start with, again, just to kind of situate us in the kind of context of how we got to this point, you guys may have seen this graphic before and certainly may have heard about the SCID journey to date. This has really shaped a lot of the work that we've done on the SCID Compass project. This work was done really at the beginning of SCID Compass to really understand what a parent's journey was like once they received a diagnosis of their child with SCID. So you can see there, it starts with that diagnosis, really starts with that screen positive result from newborn screening test, and then the confirmatory test to show that the child does indeed have SCID. The second stage of the SCID journey then moves into the pre-treatment stage, where families, along with the care team, are kind of reviewing different treatment options and deciding on the best kind of course of action. The third stage is that treatment stage. It's actually typically the shortest stage, the actual treatment. So if the family or the baby is decided is going to be doing HSCT, a donor has been found, oftentimes chemotherapy or other preconditioning drugs are administered. Finally, the treatment is conducted. Soon after, families then move into that post-treatment stage. Families are often in the hospital during that stage for about 2 to 5 months while they're waiting, or 2 to 6 months, excuse me, while they're waiting for the treatment to take effect. And then finally, the new normal stage, that last stage, is when families return home and they're really kind of adjusting to life back at home and seeking support from different family and friends or from the broader community. So again, back in the fall of about 2020, we conducted some interviews around uncertainty along the SCID journey. So you heard us talk a little bit about this last year at the SCID Summit, but just to refresh your memories, we interviewed 26 parents, about 80% were moms, 20% were dads. They had kids from not only of a variety of different SCID types of SCID, I should say, but also different ages of kids. So about a third were less than 6 months of age. Not quite 27% were between the ages of 1 and 3. About, again, 30% of kids were in the preschool years, 4 to 6. And then about 11, not quite 12% were a little bit older childhood. So that really helped us kind of get an understanding, like I said, about the different uncertainties that were experienced during the SCID journey. And here's just, again, a quick refresher on the 4 different types of uncertainties that we probed about. So starting there in the top left, medical uncertainties, not surprisingly, are a very big area of uncertainty along the SCID journey. And that can be related to anything from the diagnosis itself to different treatment options or the long-term prognosis of the child. Different practical uncertainties down there in the bottom in the blue are uncertainties related to accessing different types of care or the actual processes kind of getting to the hospital, getting to treatment centers, clinics, things like that. Up there in the top on the right hand side are different personal uncertainties that families experience. So this is anything not only kind of related to how the SCID diagnosis has affected the parent themselves, but then also their different relationships, either with their significant others, their other children in the family, certainly friends or extended family as well. And then finally, existential uncertainties were really those kind of uncertainties related to the child's kind of long-term survival or how the family really was grappling with how the SCID diagnosis was going to kind of define the child and the family's life moving forward. So when we think about those personal uncertainties, one of the themes that we really heard a lot about was around parents' mental health. So here's just a few things kind of related to SCID uncertainties that we heard about during those interviews. So parents reported that the stress of those different types of SCID uncertainties really caused strains on their own mental health and impacted their relationships. Participants also talked about how it was hard to find time or appropriate resources to really address their mental health concerns. And then finally, parents who did find applicable resources really stressed the importance of how they needed to take care of themselves and not just their child, and that they found different types of support through things like counseling or support groups or even different types of faith communities. So before we get to the video, I just wanted to, again, give you guys a little bit of context around some of the things that we heard straight from families about mental health in those interviews that really helped us realize that this was a priority area and one that we wanted to address as part of the SCID Compass project. So here you'll see a quote, and I'll read this here for you as well, around how parents often struggled with mental health issues relating to isolation. So one of the hardest things was for us was isolation, keeping our son in isolation both before the transplant and after. And so, having a support group with other SCID parents, I think is very important for people's mental health, because isolation was terrible. That was the worst thing. I don't know how my wife did it. She did it for 6 months and I did it for just 2, and I was losing my mind. Here's another quote, again, straight from families during those interviews about the importance of seeking help for their mental health. So this parent said, "I think that maybe it, meaning mental health counseling, should even be mandatory, or something that is definitely needed for families, is to have some type of therapy or counseling. I think for our relationship with her husband, it would have been super helpful to have someone to be able to talk to about our issues. I would have been more aware of how I was reacting to certain things and not knowing that it was causing more harm to myself personally, mentally. It was affecting my relationship with her husband. And I didn't realize it at the time because I was just so consumed with everything with her child, and it was just a lot." And then here, our final quote again is around how families sought support and through more kind of formal community support groups. So here we hear from the parent saying, "I know there was a SCID Compass group that they created that meets once a month, and that kind of helped because we were all in different stages. But like they were asking questions like, how are you? How are you doing? How do you feel with this whole COVID thing?" That kind of just helped, just to hear that you're not crazy. I've tried to insert myself into Zoom Bible studies or Zoom meetings with people and just talk about the good things that they're going through and living through their lives for just a bit. So as I was saying earlier, hearing about the mental health challenges that families were expressing during those uncertainty interviews really led us to want to create some kind of resource through the SCID Compass project. Earlier this spring, we actually followed up with 3 of the families who actually participated in those uncertainty interviews, and they agreed to be filmed for the creation of this video. So during the filming, we also had a handful of questions just to kind of further explore more in depth their experiences with mental health throughout their journey with SCID. And then as you'll see in the video, and you'll be hearing from Jody, we interviewed a clinical social worker who's got experience, deep experience working in the SCID community to really obtain insights on how parents can address their mental health struggles. So with that, I'm actually going to stop sharing this screen and then pull up the video. So if you'll just bear with me for a second. And I think it's going to play right away. So I'm just going to, oops, one more screen. Okay. So it's about 9 minutes, you can see. So here we go.
Having a child who's facing a life-threatening illness, such as severe combined immunodeficiency, can be traumatic.
Dean was our first child, and there's no family history of SCID, so it was very unexpected.
Thinking about all the tasks of managing the medical care, sometimes thinking about managing mental health may seem like another task or another burden, but it's actually the opposite.
My son was diagnosed with SCID at 4 days old from his newborn screening test, and we had never heard of SCID before.
What happens with complex medical trauma, which is trauma that ensues from having a disease or a chronic disease that's ongoing and can be life-threatening, is that you still have to access the medical system and you still have to manage that your child might be sick sometimes and you can be triggered again by those emotions.
I have a daughter with SCID. She's 11 years old and she's also deaf. And I also have a son who's 9 years old, and my son is her donor. He's a perfect match.
My name is Jody Taub. I'm a licensed clinical social worker with a private practice in New York. I specialize in working with patients and caregivers and family members who are coping with living with chronic healthcare conditions. And I'm also a patient who has a primary immunodeficiency. Learning how to manage trauma responses and triggers will help you to continue to navigate your child's medical care.
5 days after he was born, we got a call from our pediatrician, and she said some of his blood work came back abnormal. I think every parent who goes through something like this knows you're like, as soon as you get that diagnosis or whatever the case may be, you're in like go mode, and you're just kind of, your main focus is your child and making sure that you get the best help for them. And so it's kind of hard to step back.
We were rushed to the hospital here in San Diego to be in an isolation room so we could get more tests done. In every SCID family,
Uh-oh. It looks like the video just stopped. Give me just a second.
Parent who goes through something like this knows you're like, as soon as you get that diagnosis or whatever the case may be, you're in like go mode, and you're just kind of, your main focus is your child and making sure that you get the best help for them. And so it's kind of hard to step back.
We were rushed to the hospital here in San Diego to be in an isolation room so we could get more tests done. In every SCID family, I'm
so sorry. See if I can do it another way.
Melissa? Hi. There might be an issue with how it was transferred to your desktop, the video. Do you want to play it off of the link? Off of the Webster link?
Let me try it one more time this way, sharing it a different way through Zoom. And if that doesn't work, then I will pull it up. Sorry.
Okay.
Thank you, Oksana.
Yep.
Can you guys see the full screen now?
Yes.
Okay, let's try again.
The hospital here in San Diego to be in an isolation room so we could get more tests done. In every SCID family I've ever.
You're right. It's something wrong with the. Okay, give me just 1 second and I will pull it up from our. Okay, just a second.
Something like this knows, you're like, as soon as you get that diagnosis or whatever the case may be, you're in like go mode, and you're just kind of, your main focus is your child and making sure that you get the best help for them. And so it's kind of hard to step back.
We were rushed to the hospital here in San Diego to be in an isolation room so we could get more tests done. In every SCID family I've.
Okay, I'm not sure why it's failing. It seemed to be working. See if I can scoot past that point.
Melissa?
Yeah.
Hi. How many seconds into the video were you? Maybe I can play it off of my screen.
Yeah, I have to kind of guess. It's not showing because I can't just hit 30 seconds because it just actually shuts down on my computer. So I'll just
Okay, let me find the spot and then maybe I can play it off of mine. Give me 1 second.
Okay, let me try one more time. I'm so sorry. It does not, you don't want to play now on my computer. Okay, I'm gonna let you give it a go, Oksana. If you can't get it to go, Oksana, maybe we'll just shift gears to Jody, but we'll try one more time.
I think it's working on my computer, so let me try doing this. All right.
To the hospital here in San Diego to be in an isolation room so we could get more tests done. In every SCID family I've ever talked to, everybody remembers that day so clearly.
For me personally, I wish somebody would have told me to just as simple as work on it or talk about it prior. Like I had said before, you're in that go mode immediately. And me personally, kind of set all of that aside and put it in the back of my mind and just kind of go.
I wish I would have sought help from the beginning, but you're so busy trying to keep up with everything that you don't ever think of yourself. And now 11 years later, you sit down and you're like, no, it's about you.
While that works in the moment, as far as getting your child to where they need to be, it takes a toll on you, maybe not in the moment, but you're going to pay for it later.
You want your family to be stable and happy, and you don't ever want your kids to see that you're sad or concerned or anything, because you pass on that vibe to your loved ones, especially my kids.
I wish somebody would have told me that, because after he had engrafted and he was looking good and in the clear and released from the hospital, it all kind of hit me, and I was struggling at work, and it was just really hard to go back into the real world, and having not discussed anything with anybody, you really kind of internalize all of that, and it just kind of eats at you.
Actually, we had one of the social workers, because Nicole mistreated at the cancer center in New York, Memorial Sloan, and she stopped me and she's like, "Hey, how you doing?" I'm like, "Oh, I'm great. I'm always smiling." And she stopped me because she knew I was going through a lot. And she said, "But you're not okay, Myra." And then I just broke down because she could see that in me. But kind of took me a long time, but I finally seeked help.
Looking for a therapist or psychiatrist can feel very intimidating, and people don't know where to start. But I think if you can simplify it in the same way that you're looking for, a physical health doctor, is that all mental health professionals are trained to deal with mental health.
Reached out to the counselor I had seen before, and she was able to work with me over FaceTime, and that worked out fantastic. And that's how I'm able to talk about it now. It still wells up the feelings, but it's not as powerful as it was before.
Well, in therapy, they tell you, list these items and what bothers you, and the positive and the negatives, and then how to go about it. And it made me feel better, and my daughter as well. I think she feels better. And again, there were things that I didn't know that she was, she would tell the psychologist things that I didn't know about. But again, I know that she always wanted to put her to sleep, but I didn't know that she's scared at night or things like that.
There are various forms of therapy that are helpful for managing chronic healthcare conditions, which include cognitive behavioral therapy, mindfulness-based stress reduction, acceptance and commitment therapies are different modalities that help caregivers to be able to better manage their thought process and their overwhelming feelings. It's not uncommon if you are going through trauma that you may experience clinical anxiety and depression, and the possibility of potentially needing psychotropic medication is an option.
go talk to somebody or join a support group, or, you know, because you can discuss it with your significant other as much as you want, but there's just some things, you know, that a therapist, a traditional therapist, could help you talk through and work out.
And it's something I actually learned in counseling early on, where you have to put your own oxygen mask on before you can help somebody else. And that's exactly what we knew we had to do. We had to do to take care of our son.
Be introspective about things, and it doesn't have to be, you know, traditional therapy. It doesn't have to be joining a support group. It can be any number of things. Everybody's different. Everybody handles it differently.
There are many mental health resources that parents can use outside of just supportive mental health services. Some of these include self-care, mindfulness and meditation apps, as well as mood trackers and journals.
People that are, you know, especially my culture, you know, that we don't, you know, it's just a big deal, I guess, if you call a psychologist, but it's not bad. It's not a bad thing, you know, you need the help.
Having taken care of my own mental health has helped my family and my son, because even now, when we have to go to doctor's appointments and he's 2.5, I'm calmer. I don't get the panic that I used to.
As a provider, if you're able to bring this up to your patients and caregivers and let them know that managing mental health is just as important as managing your physical health, you're reducing stigma, and you are a trusted part of their care team, and coming from you, they may feel validated to make that step and move forward.
Don't be afraid to ask for help in any capacity. So whether it be as small as you need your friends, your family, your neighbors to make you dinner that night, whatever it may be, ask for help.
Thank you, Oksana, for rescuing us. I'm just going to pull up the slides and shift things over to Jody so that she can have plenty of time to get through her slides.
Great. So thanks everybody for being here today. I'm going to talk a little bit about mental health and SCID. There we go. Okay. So as was mentioned a little bit in the video, being a parent of a child living with SCIDs requires significant life adjustment, and managing your mental health is a key component to managing your child's medical health. So today I'm going to talk about how to manage your mental health. We'll talk about medical trauma and what that is, practical coping skills, and professional mental health support. Medical trauma. So having a child with a life-threatening illness such as SCID is a form of medical trauma. Medical trauma can be chronic for SCID families as they manage ongoing medical care living with this rare healthcare condition. So when we talk about what medical trauma is, it's different than other types of trauma. And what complex trauma is, which is what a parent can experience, which is chronic, is that the ongoing stressor is ongoing. So with other types of trauma, it could be acute and the trauma itself doesn't exist. But when you have medical trauma, there's two things that distinguish it from other complex trauma, which is ongoing trauma with exposure, is that the trauma comes from your body, from within. So it's not coming from an outside force. And that trauma can also be protective. So your body is alerting you that something's wrong, which can set off the fight or flight system. And it becomes a difficult balance when it's protective in one end, but also can set off some mental health symptoms at the same time. And then also medical trauma, it's ongoing. So it's unpredictable. There can be flares. It could be changes in healthcare. And I'll talk a little bit about what can trigger medical trauma next. So medical trauma triggers and stressors. As I just mentioned, a medical crises, changes in health status and medical instability, isolation, both physical and emotional. And a lot of our caregivers in the video today talked about that. And Melissa also spoke to that in the survey and research that they did, that isolation, that physical isolation from others then causes emotional isolation. And I think our world had a bit of a taste of it with COVID for a period of time, and how devastating that can be to be isolated. And that physical isolation, although that ends at some point, the emotional isolation can remain depending on how that changed your relationships, your ongoing stressors and support systems. So other medical trauma triggers and stressors can be shifts in medical care, caregiver burnout, grief or loss, changes in a caregiver's support system, relationship issues, lack of understanding from others about rare disease, decreased time for daily obligations and self-care, financial stressors, missed life events, and anticipation of the future medical setbacks, which also Melissa talked a little bit about in her conversation about uncertainty, shame or misunderstanding from medical professionals. So I want to do a quick mention of signs and symptoms of anxiety and depression, because often I'll hear people say, well, I must not be depressed because I'm not staying in bed all day and I get up and I do things. And well, most people have to do that. And what anxiety and depression does is we suffer in other ways that may not be as clear and apparent to us. So some signs of depression would be sort of acting out, feeling anger, rage, irritability, low tolerance for daily stressors, and negative thinking. One way to kind of determine that is you're just feeling sort of low across the board. You might be feeling irritated and annoyed, or you could be feeling like you're not getting what you want out of your day, and just getting through daily tasks can be really challenging. So turning in can be decreased interest in school and work or social activities, poor hygiene. It's difficult to do some of the things you need to do. Now, that caveat with SCID parents is obviously you have to keep very good hygiene to keep your child safe. But it may be in terms of like self-care for yourself, where you may have stopped wearing makeup, or you're always wearing sweatpants and you forget to do some of those things that might just make you feel a little bit better about yourself. Feeling bored, feeling like you're not receiving the type of joy from everyday tasks and experiences, feeling isolated from your peers. Tearfulness, some people will get really tearful and emotional, feeling intense sadness, hopelessness, perseveration of thoughts, which is you can't really shut off all of the thoughts. So you're constantly, some people will describe it as a hamster wheel, where it just kind of keeps running and you can't seem to turn it off, and it causes distraction. Pit-like feeling in your chest or stomach. Anxiety would be ruminating about future events which are out of your control. So something may happen during the day, and then you go through a series of hypothetical scenarios that you really can't answer. Ambivalent thoughts, so going back and forth about even just simple everyday decisions, and it makes it harder to focus and concentrate and get through your day. Obsessions and compulsions, so we're getting into some of the clinical symptoms that can happen with some people if they had a predisposition. So counting, checking, and hoarding. Disruptions to sleep patterns. So anxiety can cause people to wake up early, or to wake up, they might be able to fall asleep, but they wake up in the middle of the night sometimes, and it's hard to fall back asleep. Physical symptoms can be rapid heartbeat, difficulty catching your breath, uncomfortable energy, and panic attacks. Recent studies show that individuals living with rare disease face higher rates of anxiety and depression, and this also counts for caregivers, true, that, you know, if you're a part of this experience with your child, you're in all of this, and it can be really difficult because of all the stressors. I also want to say this does not indicate that you don't have coping skills, that you are not a competent person. You are above and beyond competent in all of the things that you're managing. And anybody who had to experience all of these stressors would be at risk for facing anxiety and depression. And just because you experience that doesn't mean that you're not, you're not able to do something about it. And so if you do experience some clinical anxiety and depression, we want to make sure that we help you to address it. Obtaining the right relationship support. So we'll talk about coping skills, and there's lots of different kinds, but I think in particular, I think relationship support is one of the most important avenues that all of you on this call today need to explore. Self-care and taking care of yourself and your needs and taking care of your child are very important, but you need help and you need to feel that you're loved and a part of a community and have others who get it. So acknowledge that family, friends, and loved ones may not understand how you need support. When we offer support, often we provide support the way that we would think that we should support others. And because this is such a rare condition, most people would have no idea what it felt like to be in your shoes. And so they may offer things in a different way. And I think, think about the people in your lives and how they can give support. So there might be people who are really good at providing emotional support. There are people who might be good at providing practical support, and to focus in on those people and lean into their strengths, which I'll talk about. So prioritize community support because it decreases isolation and increase connection to others. And I really dig into this connection to connection. And even now with COVID and some positive ways, people have learned how to contact individuals through online resources and virtually. And if you're not able to see people because there's safety reasons, find a way to do it. So initiate conversations with other people about how to do this, about what you feel comfortable with. COVID has presented another circumstance, and having to maintain safety for your child maybe in a longer way than you would have before. And so you should have an ongoing conversation around how you can see people or be in touch. Be compassionate and patient with yourself and find ways to take care of your own needs. Just like one of our caregivers spoke about today in the video, you have to put on your own, safety gear and you have to take care of your own self before you can take care of your child. Connect with SCID caregiver peers through support channels. I highly recommend connecting with other parents who understand this very rare experience. Focus on your individual strengths. Remind yourself of all the things that you can do, all of the ways that you have been capable, and the resilience that you have derived from this experience. Many of you have probably tapped into wells that you never even thought were possible. And it's important to not just focus on, oh, wow, I've really experienced this trauma. And it's also reminding yourself that not everybody comes out of difficult life experiences with just trauma. You also come out with resiliency and the ability to believe in yourself and go past what you thought you could do. And that's important to remind yourself of that. Lean into support of others. When you go through difficult life experiences, sometimes people show up and sometimes people don't. And sometimes people surprise you, and the people who are offering their help take advantage of that. Try not to focus on the people who might not be available in that moment. Talk to your physician about mental health status and needs. I think this is really important, and I touched on this a little bit in the video. I think in experiencing the medical world, they focus on the physical, and we talk about all the things that we need to keep your child safe and alive, but we don't talk about what that's like mentally to manage that and what you can handle. And I think it's important to tell your doctors, hey, this is how much information I can handle today. This is how much I can manage. This is what I need from you. This is what I might need from the nursing staff to help me better manage this process. There was a study in 2020 on how social support, stress, and life satisfaction impacted adults living with rare disease, and companionship support was the most important for satisfaction with life. So find ways to connect with others. It's all that important. Practical coping skills. So I'll go over this area quickly just because it's part of popular vernacular now, but I recommend these are tools that you can use. You don't have to use them, but they're just more to put in your treasure chest of coping skills. So mindfulness and meditation resources, mood trackers and journals, and mental health resources. mindfulness and meditation resources. And all of these resources will be available to you after the session today. So some of the apps that are useful can be Smiling Mind, Insight Timer, and Headspace. I also have here some mindfulness and meditation books. So there's a book, MBSR Every Day, Daily Practices from the Heart of Mindfulness-Based Stress Reduction. John Kabat-Zinn, who's the founder of Mindfulness, wrote Full Catastrophic Living, How to Cope with Stress, Pain, and Illness Using Mindfulness Meditation. And then the Mindfulness-Based Stress Reduction, the MBSR program for enhancing health and vitality if you are a reader. Mood trackers. Mood trackers are really helpful in tracking patterns in mood behaviors and feelings. One of the caregivers talked about how they were just sort of in to-go mode. You just go, 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 and you're in crisis trying to just manage all of the things that you need to do to manage your child's medical care. And sometimes you don't see patterns or see that your mood has shifted or see that you're suffering until you're out of that crisis. So mood trackers are a good way to sort of navigate, wait a second, I've noticed that my stressors are adding up and it's affecting me. It decreases negative thought patterns and can examine automatic thoughts. So, and help you to identify triggers and patterns. So Dailyo, Mood Tracker, Mood Kit, Mood Tools, Mood Mission, they're all different options, but they do the same thing. I've included some mental health resources for associations and institutes. And again, I'm not going to read through it, but that can be found in the resources after the session today. And these are just additional journals and other resources. So professional mental health support. So this means working with a medical professional in order to work through the process of dealing with all of the stress of living with a child who has a serious life-threatening illness. Talk therapy, so that's what I do. So obviously I'm going to be a strong advocate for talk therapy, but I think everybody can benefit from that. And if you have the opportunity to participate in talk therapy, I highly recommend it. Talk therapy can help you to strategize. It can help you to think about ways in which to build relationships with other people and to manage anxiety and depression. It doesn't necessarily mean that you have to be depressed or anxious to benefit from talk therapy. And it's also educational. You learn coping skills and strategies that you may not have known about before. So there's various types of talk therapy that are helpful for dealing with chronic health. That's ACT, which is acceptance and commitment therapy, CBT, which is cognitive behavioral therapy, mindfulness-based cognitive therapy, MBCT, and MBSR, mindfulness-based stress reduction. And all of these different modalities have been found through research to be helpful. Psychiatric assessment for psychotropic medication. So if you are experiencing clinical anxiety and depression and you need to see a psychiatrist, you can do so to make an assessment. I highly recommend, if you can, using genetic testing for psychotropic medication. There now is there are two different types through Genocyte and Genomind. And the psychiatrists and mental health nurse practitioners who are able to do this, you can go to either of the sites and put your zip code in, and it'll let you know who does this. Actually, 2 weeks ago, there was a study that came out and it talked about the benefits and how patients were receiving better outcomes to figure out the right medication for them. People may not realize that there's different reasons why people may experience anxiety and depression. It could be you have problems with producing cortisol, it could be methylfolate in your bones, it could be a dopamine issue, and the genetic testing tells you what med you should be on and what dosage you should be on. And I can tell you from all the patients I work with, every single one of my patients had a different patient profile. So I highly recommend that. That way you don't experience the type of side effects that you can if we just sort of guess. And then lastly, people always ask how to find a therapist. And I know that it can feel really overwhelming based on your insurance, based on your state that you live in, based on your own personal needs and who you feel comfortable seeing. I always recommend using Psychology Today through Therapist Directory because it's the largest database of therapists, and you can type in keywords such as chronic illness. You can type in your insurance if you need to be in network. And as I said in the video, all therapists are trained to deal with mental health. So just because you might not find someone who deals with rare disease or chronic healthcare conditions does not mean that they can't understand the scope of the issues and can't help you through the specific mental health coping strategies. So in closing today, prioritize managing your mental health. It will help you to better navigate the SCID journey.
Great, thanks, Jody. So we have 5 minutes left, actually. So I'm not sure if Emma is still on, but I think we are happy to take any questions here for the last few minutes.
Yep, I'm gonna go ahead and enable everyone. So if when they ask their question, they wanna pop on video, they can do that. Just give me one moment.
You are also welcome to put things in the chat if you'd like to.
All right, so I think folks should be able to, if they click on reactions, you'll be able to see the little raise hand function. So if you have a question you want to ask, go ahead and raise your hand, and then I can individually unmute, and then you can ask your question. So feel free to raise your hands.
I see a comment in the chat from Heather. Thank you all again for your patience with the video. We had tested it out and it was working well, so I'm glad we got it to work. So thanks again, Oksana. I hope you enjoyed it. It will be available on the SCID Compass website shortly too, so you can see it there soon.
Or if you have questions, again, you can chat them in, you can raise your hand.
And I just want to mention again, I know there were many links for great resources that Jody pulled together. I don't know, Oksana, if you want to drop the PowerPoint file in the Zoom chat so you all can download it, because all of those contain actual hyperlinks to the resources.
Actually, it seems like I don't have the
don't
ability to drop anything in chat.
Okay.
I'm not sure if it's just me, but we will pass it on to you through Emma. Maybe we'll include it when we post the video. Yeah.
All right, well, if there's no questions, we certainly thank you. Oops, I did see just a couple come in. Sorry, I didn't scroll.
We have two, Melissa. We have two questions. Yeah.
Okay, great. Thanks, Heather. I think it's important. You know, as I was saying before, sometimes, you know, life experiences can happen and can occur and we move on with our lives, but there are things that may remind us of experiences. So a young adult who is a SCID patient, but maybe as they're thinking about having their own children, or they do have a child and it sort of brings up some of those feelings about their own experience or some of the things that they experienced as kids. And as an adult, you know, many of us start to process what happened in childhood. That's the crux of therapy. So it affects us as an adult. So I think it's a great idea for young adults with SCID to seek therapy and talk about that and to process their experience.
And there's another question just above Heather's from Stephanie Jody. I don't know if you can see that about siblings, if it's recommended to have group type.
100%. So we didn't get a chance to talk about this today, but this experience affects the entire family. And often what happens with siblings is that they feel, you know, they have their own feelings about their sibling being ill, but they have their own feelings about their parents, like having to maintain their own stability because they don't want to put an added burden on their parents. Or there's sometimes we have siblings who may, resent that experience, feeling like their own needs haven't been met. And so it's really important. I highly recommend doing group therapy, family therapy. It may be affecting your relationship with your significant other. So you might want to do couples therapy based on, when you need it and what's going on in your lives. The more therapy, the better. Oh, I see a question just really quickly. It says, how does family therapy work? So what family therapy does is it allows a space to look at the dynamics of what's going on with the family at the time. So, and it also provides a safe space for family members to talk about things. So there may be, just like I had mentioned, a perfect example would be with siblings where they might be fearful of telling their parents that about what's going on with them or their own needs because they don't want to add stress or burden to their parent, or there might be other life things that are going on that they just feel like they can't talk about. And family therapy will allow, in the same way individual therapy does, to focus on what's going on in the moment too, and to come up with coping strategies and different ways of communicating for all of the family members to provide additional support.
Other questions? I know we're already a minute or two over, but we're happy to stick around if folks want to chat more. I think the next session starts at 1:10, but thank you again for your patience. Look forward to sharing more resources through the rest of the SCID Compass project.
Looks like we got one more question from Audrey. All right.
Can you see that one, Jody?
Yep, I think that's one for Jody.
I think as soon as your child, I think assessing where your child is, but I think the sooner the better. Child therapists, I worked with children when they were younger. Now, the question may be COVID creates a different scenario. So, we see children in therapy as young as, 3 to 4 years old to start learning about language to express their feelings and how, and that's usually done through play therapy. Depending on the safety circumstances and if therapy is virtual, it may be that you need to utilize therapy a little bit older when they have some more verbal skills. But I think that providing resources to your child as soon as possible for learning how to talk, learning how to communicate, learning how to express their feelings and matching the words to feelings is very important. And as soon as your child can and is able to do that, I think you should go ahead and seek those supports.
And Michelle just had a follow-up question there about family therapy. Would you do it individually and then as a family, or just always together as a family?
You could do both. So, it may be that you're doing, I'm just going to read the question. Like, you may need therapy for yourself, and then there may be a point where you're doing family therapy, or it may be that you're in a crisis and the family therapy comes first, and that's what you really need to utilize. So I think based on where you are and what you can do. So, there may be a time frame that you don't have time to do both, but one is more important at that moment. But, doing both of those things at the same time can be really helpful.
But typically family therapy is just the family as a whole. There wouldn't be individual.
Correct.
Therapy, right? Yeah.
Correct.
Okay.
We'll give it a couple more minutes for if anyone else has some questions. As Melissa mentioned, the next session starts at 1:10 in about 5 minutes, and that's going to be the Premature Infant Surveillance and Quality Improvement Study with APHL. But again, if you have any more questions, we'll be on here a couple minutes more. All right, it seems like everyone has asked their questions, so I think we'll go ahead and wrap up. Thank you so much again to Melissa and Jody and Oksana. We're so excited to add this awesome video to the SCID Compass website this summer, and we will certainly make sure everyone has the link to find that once it's up and running on the website. Thank you everyone for joining this session. We hope you enjoyed being able to be a little bit more collaborative and ask your questions in the chat. So we're going to go ahead and end this session, and we'll see you in 4 minutes for the Premature Infant Surveillance and Quality Improvement Study with APHL. Thank you so much, everyone.
Thanks, Emma.